top stories. Savannah Police are taking a new approach when it comes to responding to mental health and substance abuse calls.
They put together a new unit made up of health professionals and trained officers.
WSAV News 3's Ricardo Lewis explains how SPD wants to decriminalize a call for help in the hostess city.
The Savannah Police Department has created one of Georgia's very first behavioral health units that will help respond to police calls involving individuals suffering from a mental health crisis or substance abuse.
The officers of the BHU are able to go to that scene and begin assisting that person with whatever that crisis is or whatever their need is, and then put them in connection with the services that are available.
SPD is stepping up its crisis intervention training. Right now, 70% of the force is certified. The unit will have 2 non-uniformed SPD officers and a licensed clinician. The clinician will ride with the officers 2 days a week to help better provide a potentially life-saving outcome.
So really being able to talk to a person and gather that information, try to figure out what happened that brought them to that point, and then pinpointing exactly what's going to be that best resource connection.
In the past, police would take the individuals to the hospital or to jail, but now SPD is looking at other ways to decriminalize mental health issues. The department received a federal opioid grant last year and began researching similar units. This unit is modeled after Portland, Oregon's police department.
What we're trying to do is increase their chances of success, and the more that we're keeping them on that track and working with them to get better, is the less they're involved in situations where 911 is going to be called or where they're ending up in jail.
Ricardo Lewis, WSAV News 3 on your side.
Last year, the department responded to more than 3,700 calls for mental health. In the last 3 months, officers received more than 560 calls.